Use stockinette for comfort, padding or 7.5cm web roll to protect bony surfaces, and for general protection, 10cm plaster of Paris for the slab, trauma scissors, cold water, crepe bandages and tape. Positioning is with the patient sitting with the elbow supported on a table and flexed to 90 degrees. The thumb is pointing to the patient's shoulder. The forearm is neutral and the wrist 20 to 30 degrees of extension unless otherwise requested. For the cast, estimate plaster length by laying the dry splint next to the area to be splinted. 8 to 10 layers along the volar surface of the arm. The distal margin is the distal palmar crease on the palm of the hand, and the proximal margin 3 cm below the elbow crease. Cut a semicircle, a third of the width of the plaster of Paris slab at the thenar eminence. Ensure adequate analgesia prior to the procedure. Inspect for wounds and clean and dress normally. Apply stockinette to the arm beyond the margins of the plaster and cut a small hole in the stockinette for the thumb. Apply 2 to 3 layers of web roll beyond the plaster margins, tearing or cutting as it passes through the first web space. Ensure the wrist is well padded and the web roll overlaps itself by 25 to 50% with minimal creases. Submerge the pre-prepared dry backslab in the water until bubbling stops and then remove. Squeeze out excess water and smooth out as demonstrated, and apply along the volar border of the forearm. Turn back the padding around the distal and proximal margins of the plaster of Paris. Apply crepe bandage firmly over the slab and fasten with tape. Gently mould the plaster of Paris to the patient anatomy, palm particularly, maintaining wrist and elbow position until hardened. For unstable fractures and post-reduction, a sandwich slab may be used. This involves using a volar slab combined with a simple dorsal slab. Apply crepe and secure as you would for a simple volar or back slab, using moulding and angulation depending on the specific fracture type.